I'm glad so many of you could virtually join us on Zoom for the St. Louis Regional Chamber's COVID-19 briefing on school reopening. Before we begin, I'd like to take this moment to thank all of our healthcare and other essential workers who are on the front lines during the COVID-19 pandemic. I'd also like to thank all of our members and partners on the call that were a part of our recent successful push to pass Medicaid expansion in Missouri. Medicaid expansion has been a priority of the Regional Chamber since 2013 because of the significant impact it'll have on the health of our workforce and economy. Our team at the Chamber appreciates the leadership of our fantastic members and partners across the state who stepped up and got it done. I'm Austin Walker, Vice President of Public Policy at the St. Louis Regional Chamber, and today I'm excited that we have four fantastic leaders joining our COVID-19 briefing. Dr. Kelvin Adams, Superintendent of St. Louis Public Schools, Dr. Art McCoy, Superintendent of Jennings School District, Patricia Coleman, President and CEO at Behavioral Health Response, and Dr. Randy Pembroke, Chancellor at Southern Illinois University, Edwardsville, will discuss school reopening in a COVID-19 environment. I'd like to thank our speakers for their leadership, support for the region, and for taking the time to join our virtual meeting this morning. If you have a question you'd like answered by any of our speakers, please use the chat in Zoom, and we'll do our best to get to your questions. Closed captioning is also provided during these briefings, so feel free to use that feature as well. Before we get started, I'd like to thank the St. Louis Regional Chamber's 2020 policy sponsors. Their contributions support our policy programming throughout the year. Now I'd like to introduce the Superintendent of St. Louis Public Schools, Dr. Kelvin Adams. Dr. Adams began his duties as Superintendent of Schools for the St. Louis Public School District in 2008. In his role as Superintendent, Dr. Adams oversees the school district serving 22,000 students in grades pre-K through 12. The St. Louis Public School District operates 68 schools and employs more than 4,000 people, including 2,000 teachers. Please welcome Dr. Kelvin Adams. Dr. Adams, the floor is yours, sir.
Good morning, and thank you very much for the opportunity to spend about 10 minutes with you sharing what we're doing as a district as it relates to this particular virus. I will start by hopefully sharing my screen and walking through a presentation. The screen being shared, I'm not really sure.
It is not yet. There should be a screen share button on the bottom bar.
I'm not sure if it's working. I can't tell.
We can see your screen.
Okay, great. First of all, we started with a committee being put together at the end of April, looking at the possibility of what we needed to do as we reopen school. Closing schools, quite frankly, was easy compared to reopening schools. And so we put a committee together made up of community leaders, parents, teachers, partners as well. And we started the conversation in late April talking about what we needed to do. We called that the Restart Task Force Committee as we looked at 5 key subcommittees: governance, wellness, instruction, facilities, and technology, to come up with what we were looking to do as we were thinking about schools reopening. We had 10 priorities, guiding principles, if you will, with safety, physical and emotional health and well-being being a priority, also well-being and cultural responsiveness. But we came up with some criteria or guiding principles, if you will, for what we needed to do as we looked at the notion of returning kids back to schools. Part of our restart process was a 4-phase process. Phase 1, really guidance from the health department in the city of St. Louis. Phase 2 was looking closely at the updated information that was coming in as information was changing on a regular basis. Phase 3 was really looking at all of the documents. We looked at over 100 documents that had been put together from the Council of Great City Schools to regional superintendents to health professionals as we came up with the idea of what we needed to do. We tried to engage everyone in this particular conversation over the last 3 or 4 months, and we came up with the idea on phase 4 of what we needed to do with the idea of restarting schools sometimes in August, and I'll talk a little bit about that. The communication with the community was a real key component, and you will see in phase 2 under communication with community, we surveyed our parents, and I'll reference that a little bit later on. The notion of why reopening schools is such a critical piece, and I'll just give you some data points here because I think it's critical to understand that returning students to in-person classroom is a major step in terms of helping students bridge the gap and preparing them for jobs that do not exist today. We realize that if students are not in school, what the data is indicating to us is that there's a 4th grade reading loss. There's a math reading loss to the point of negative 81% decline in math RIT scores, which is equivalent to about 14 months of learning loss, 6 months of learning loss in reading. The achievement gap increases, especially for those students who have the lowest performing students, as well as those students who are minority students and students who don't have access to technology. Looking at the data for Katrina, and I was a part of what happened in New Orleans relative to Katrina, it was a 4-month learning loss, which really required 2 years of normal seat time just to catch up. So this notion of going back to school is critical. We looked at working with the city of St. Louis, and we came up with some guiding principles: an infectious plan, the notion of social distancing, making sure that all of our students had immunizations, because if they have immunizations, it supports the notion that they don't have weakened immune systems and could possibly be impacted by the virus. But you can see here some of the kinds of things that we look to put in place as it relates to the virus in preparation of coming back to brick and mortar in-person classes. We also looked at the idea of a mask for all students, what would happen on the bus, taking everybody's temperature, making sure all staff persons would do the screening prior to coming back to work. But basically, we put guidelines in place in preparation for us coming back to school in person. What we decided to do, as I said before, was to survey our parents, and our initial survey data indicated 35% of the families wanted virtual, and 65% of the families wanted to come back to brick and mortar. That was done in June. When we did the survey again, and this time it was a commitment form, you can see what the data says. 33% of families would say a month and a half later that they wanted to be in person. That was directly opposite for what the initial survey said. And 61% are really, if you add 61 and 6% in terms of a program that we put that's much more student-based as opposed to having support from faculty and staff, about 67% of our families are saying now, as of July 30th, that they wanted some form of instruction by virtual, not in person. So the data shift. We looked at a number of data points as the number of cases continue to increase, the number of staff persons who were filling out forms for FMLA. All of those factors went into us making a final recommendation to the board. And the final recommendation, quite frankly, was that all students will receive instructions online. And that is a decision we made about 10 days ago. But we also nuanced the decision by looking at the fact that we know we needed to support students who did not have the opportunity, who would not have the opportunity, quite frankly, to get the kind of support they needed, would not have the opportunity to get breakfast and lunch, would not have the opportunity, the families did not have the opportunity because they were working and essential workers. So what we're looking to do now is to open 20 instructional support centers. As the latest data last night indicates, about 2,500 families are saying that they still need some level of support. So we're opening instructional support centers from the hours of 8 to 3, maximum 150 students in a building, 10 students in a class, counseling, breakfast, all of those kind of support pieces in place, while students are still tied to online instruction. The teacher record will still provide them with instruction, but this is a support center where they could get tutoring, and certain staff members as well as our partners will come together to support them in this avenue. As we continue to do this work and continue to look at the challenges that our neediest kids have, we are simply advocating to make sure that those students get the direct support, face-to-face support, in-person support in a small environment. In addition to that, it gives us the opportunity to try out all of the recommendations that came from the city in terms of screening kids, in terms of checking temperatures, and all of those kinds of things. And so these are our recommendations. These are the recommendations that we put in place. It is likely that all of the parties that are in the city of St. Louis, charters, as well as some private and parochial, are looking at some of the same kinds of details as it relates to supporting kids. At least the 21,000 kids that we support, but the 40,000 kids who have an opportunity to receive education, free education in the city of St. Louis. So that's what we have done as a district to address this notion of COVID. And at this point in time, I think there are about 3 minutes left to take any kind of questions that anyone might have through the chat.
Yeah, Dr. Adams, really appreciate that. Yeah, I got a question about, we talk about how students go back, and you gave a good presentation about that, but could you maybe talk about why it's important that students go back to school?
Well, as we looked at the data coming back from families, I was not amazed, but surprised to see that a large percentage of families who wanted their children to come back in buildings, and that was about 5,000, indicated that the social emotional connection was incredibly important. The children felt isolated, the children were depressed. And so part of us opening these instructional support centers is that we'll have counselors and therapists there to support kids who have the greatest need, who have felt that way. And so the data is really clear. They need to go back. Families need to work. That we're part of that fabric that does that. I think we have a moral obligation to do that. And obviously, I shared a slide that really talks about the academic loss, the learning loss that occurs, especially for students who have the greatest need. We're providing all of the technology that kids need. So need a laptop, an iPad, and the internet connection, a hotspot, such that students can do the virtual work. But at the end of the day, that personal interaction with staff and students is really critical.
Yeah, we got a question on the chat. Those students coming in for instructional support center, will the district offer school buses or transportation to and from school?
Yes, sir. We will handle transportation. We will provide related arts, meaning art, music, PE, counseling, therapy, breakfast, lunch. Yes, the intent is that we're providing wraparound services to support those kids that come in. If there's some of our populations of special need, ELL, special education, and so those kids will have an opportunity to come in. That still will be tied to virtual instruction, but the support will be there to give them the kind of feeling that they are being supported in an environment that's safe and secure.
Thank you. And Dr. Adams, what happens if a child or teacher is diagnosed with COVID-19? What kinds of plans does SLPS have for an outbreak?
Well, we've had, at this point in time, if my numbers are correct, approximately 20 of our staff persons have been identified with the COVID-19 virus. We contact the health department and we do some level of contact screening. Not us, but the health department does some level of contact screening, and we isolate those persons for 14 days. They have to retest again before they come back in. We have not had a large outbreak, as you've indicated. If that does occur, we will shut down the site, do the deep cleaning that's necessary, quarantine the persons that would be identified with being in contact with that person, is what the health department will guide us to look to do, because we've had multiple conversations with them and have some history, quite frankly, from the summer when we were doing free feeding in our schools to do this. So those are some of the protocols that we've put in place.
And Dr. Adams, last question, looking into the future, will schools fundamentally change the way they do learning? What does the future hold for St. Louis Public Schools?
I think this is a real challenge, quite frankly, across the entire educational landscape. We have not done this to this level before, and so I think there is a likelihood that the way we provide educational services to students will dramatically change. You will see more of the kind of conversations that are taking place now on Zoom with kids and the online avenue. But in addition to that, I do think that it will give some opportunity for innovation to take place. Educators have been incredibly fixed in terms of how they provide instruction. I think this will open the door for innovation to take place in a way that it has historically not because we want to, but because we have to.
Well, Dr. Adams, I really appreciate that. Really appreciate your time. You've got a really big job, and we appreciate you keeping our students safe. Thanks for your time today and being here with our members.
Thank you very much.
Thank you. And now joining us is the Superintendent of Jennings School District, Dr. Art McCoy. In 2016, Dr. McCoy became the Superintendent of Jennings School District. And under his leadership, the classes of 2017 and 2018 achieved 100% graduation in career and college placement. Prior to his role with Jennings, Dr. McCoy was the youngest and first African-American superintendent / CEO of the Ferguson-Florissant School District at age 33. Please welcome Dr. Art McCoy. Dr. McCoy, the floor is yours, sir.
Thank you so much. It's a pleasure to be with each and every one of you, and it's good to see each of your faces, Pat and Jean and Valerie. We work closely together on the NAF Academy Board and Executive Board for the region and getting kids into jobs and workforce development. So thank you all, and Scott, thank you everybody for having me. So in my 10 minutes, seeing that it's 10:17, I'll definitely give about 7 minutes of presentation, and then I will do some Q&A as well. Let me first start by saying this. I'm going to speak for a little bit, and I do have a PowerPoint, and I see that you don't see my face maybe, or you see my face in a small way. So I'm going to share my screen once. Yeah, I'm going to share my screen right now. So ultimately, I want to give 3 statements. And you should see my PowerPoint, but that's my contact information if anybody needs to call me on my cell phone directly, some data points that I'm going to speak based off of to reference and so forth. But if education is a civil right, it was very difficult for me and my team to come to the conclusion to deny that civil right, which is in the state statutes of Missouri, to deny that from parents. So we took a position, I did, frankly, to not close the doors of our schools, but to have the parents choose to keep their kids home. The parents have the power to the people. The people can choose to keep their kids home. And I've actually asked them to select having your child stay home if you are privileged enough to have childcare services or have a job where you can work remotely, then you could choose. But ultimately, because we believe that education is a civil right and it's a state statute right, we chose not to shut our doors, but to have the power go to the people to say we choose to not enter into the doors. Now, for daily learning for students. So then the question is, what are we doing? The first thing we did is have a meeting on the 15th of March. I did with the county executive's office and the health department to say, hey, a tsunami is coming called COVID-19. You may have to have your schools shut for the remainder of the 2020 school calendar year, not just school year until May, but until the calendar year through December. That's what the county department told 10 superintendents who was invited to that closed door meeting. From that point in time, I told my staff and students, pack your things up because you won't be back into this building for a long time. So pack up things over the next 2 days if you're not returning at all. That was different than most districts. They were kind of taking it as they saw it and saying, maybe we'll come back, maybe not. We, in 2 days, shut everything down. And by March 17th, we were all out. Everybody had the appropriate technology and so forth. So now, let me say, I told my staff to get packets for our students prepared so that they can study the MAP test and give every kid every computer we have so that we will be one-to-one. Now, thanks to Valerie Patton's help and others, corporations like Enterprise and Worldwide Technology, we had raised $1 million and we were already one-to-one for computers for 3rd grade through 12th grade. Thanks to MasterCard, Worldwide, Valerie Patton and her organization contributing and helping us with that. So we had all the computers already signed out to 3rd grade through 10th grade, 12th grade. We ended up giving laptops for kids to have as a senior present and prize for 12th grade. And then we used our funds to purchase more computers for K1, 2, and ultimately without mouses. So computers without mouse pads. So that was the work we did in March during our spring break. So we technically didn't take a spring break. And so that right after our spring break was done, which we accelerated to the date that we said, you know, when you leave, the 17th of March through that week, we then resumed online learning immediately after our forced spring break. And students did a learning situation where their grades were frozen and their grades could only go up by the work that they completed. We had 90% of students participating online virtually. It was, I would give it a B minus, given the short-term situation, because we were already one-to-one and had some online learning in place. So on April 9th, being on the governor's task force for COVID, I made the recommendation to the governor at 11 a.m. After a superintendent's meeting that we had at 9 or 10 a.m. to make the decision to close all schools throughout the state of Missouri. Governor Parsons did that for the sake of uniformity everywhere so that we could know that this was serious and get our behaviors in check. Now, moving forward from that, most schools did the best they could to finish that school year providing food. Like we provided over 2 million pounds of food to our families in St. Louis City and County, because we serve 63136, which is a part of St. Louis City and a part of St. Louis County. People were coming from every direction to get the food. 2 million pounds of food given every Friday, at our 2 grocery store food hubs, which gives grocery store foods daily, because we don't want to have food deserts. There's only one major grocery store in our school district, that's Snooks. And so every school has a garden, and we have 2 grocery stores that we own and operate, so that we eliminate the social determinants of health being not eating good food. We were doing this before COVID. Now it's especially important during COVID. So in June, we did summer school virtually. After the end of the school year, we did a parade. We did a graduation ceremony that was outside with great spaces, with cars parading through and kids walking across the stage. Everything went well. Jennings has had no students have COVID for anything that's they're done in school in any of our activities, no staff either. So in July, well, let me go back to April. In April, the Department of Education and the State Department asked if we would open up our schools to serve first responders, because police officers haven't stopped protecting and serving and doing what they do. That may even be not so much protection, but still serving. Firefighters have not stopped doing what they do. And 911 dispatchers and others have not stopped. Grocery store workers have not stopped. Even custodians in my district have been at school every day, not one day that they missed, even when school was closed. So the essential workers have been doing the essential work. So we were asked to provide childcare in April for those essential workers who were in our district, which we made amends in preparations and plans, and we provided that. Then in July, after making sure our practices were solid, we had a plan that was actually written and approved. It's on the screen. The first in the St. Louis County. It was done by May. I became a contact tracer from Johns Hopkins, and then I advised my leadership team to do the same, and I have over 30 contact tracers in my district. I advised other superintendents all in St. Louis City and County to do the same, that it's the best means for creating a plan in May, and many have done it. I think over 100 have done it now in the region, and now the governor is advising everyone to do it in school systems and beyond, as you've seen from his press conferences. On your screen is our Jennings Plan. I'm gonna show you how, I'm gonna say it in a few words. The bottom line is we're the only one with a plan that's 1 page. Literally, this 1-page chart is our entire plan for COVID. It's interactive, but it's 1 page, so they can be posted everywhere. And it talks about the context of COVID: no cases, low cases, mid cases, high transmission, high cases, high transmission. Means you phase in, you go gradually. So what will Jennings do? We will have preschool through 3rd grade coming every day for the students who need it most. Any student who will be in neglect, they can come every day. So that means if you're a 9-year-old, 8-year-old, 7-year-old, it's illegal for you to be at home alone. That's neglect, unless you have a parent or a guardian. Well, you can come to school. 4th graders through 12th graders, they come to school every other day, an A-day, B-day schedule. And then everybody, we're urging everybody who has the privilege of having a parent at home or having a loved one, you may stay at home. You may learn virtually, and we're asking them to learn virtually. So anyone who faces neglect may come to school. Anyone who has the privilege of working from home and having care at home may stay at home and learn virtually. You have click responses as to when to keep your child at home. You just click on that button on that 1-pager, and it takes you to this website that says, this is when you keep children at home for all the sick reasons, including COVID and beyond. Beyond that, you have another click item for our survey and / screener that every person who's in our school district must do a screener when they come to work. So I'm clicking on it now. See that? And now you have the screener up. So this is for employees, this is for volunteers, this is for visitors, this is for students. Before you step foot into the campus, you fill out this online screener. Then you get a temperature check at the door with temperatures and symptom checks at the door. That's our phase 2. Then the first class you go to as a student, you sit down and you fill this out and you sign your name to it. So it's a 3-step process. Every kid who does this, they're sent away if they say that they check yes on any of these symptoms, or parent or adult. Then at the door, if they don't have the right fever amount or temperature or has yes to this, they're sent away at the door, or they're held in an isolation room. And then in the classroom, if they sign their name to say the yes to this, they're taken back to a isolation care room, and then counseled by a nurse, and then either sent home or stay in an isolation room until they have appropriate child care. We did this for an entire month with summer school face-to-face in July. We had 0 issues of COVID transmission from adult to student, student to adult, adult to adult, 0. We have 2 testing sites on campus. We have Care STL Health. We also have the Spot Clinic, Washington University at our high school. They've been open, seeing people every week, every day. So I've showed you our one-page plan. I've showed you our screener. I've showed you our website connection. And basically, I've given you an overview of what we're doing. But the long story short is, if education is a civil right, the parents have the right to deny that right, as opposed to shut the doors. And then once the cases are so significant that we go on stay-at-home orders again, then the doors are shut. But our goal is to do this competently, as we have done for now 2 to 3 months with childcare from April to July. And with given our size, I think this controlled method will have about 20% of our students present and about 40% or 80% of them at home on a given day after you send people away by checking out the symptoms ultimately. And that will be small enough to be at the 10% to 20% occupancy rate that the businesses are at, 25% now. And then if it goes down to 10% within every other day cycle, you're already at 10%. And so we know this. We're going to be living with COVID into 2022. So that means that BC is gone. BC, some people call it before Christ. I call it before COVID. That's never coming back. AC is after COVID, not after Christ, but after COVID. That's going to be 2022 before a vaccine is created, tested, reasonable enough for you to afford or free, and then trusted enough to take. Unlike some people like myself who won't take any vaccine, because I remember syphilis vaccines and so forth for other individuals of color and so forth. So it's going to take a while to trust the vaccine. So that's 2022. Our herd immunity is 2022. So we're going to be living in the DC area, not for District of Columbia, but during COVID. And it's going to be 5 times worse, possibly by Halloween, when most schools are trying to come back, than it is now, because you will enter the flu season in addition to the COVID season. So, you know, that sheet of when to keep your child at home, you're looking at stuff like influenza, common colds, flu, vomiting, pink eye, sore throat. All of this keeps the child at home, not to mention COVID. So we need to exercise as a school community in Jennings, the practices and protocols and procedures of how to master doing school without any transmission today, so that when it's worse tomorrow, we'll at least have some protocol. I thank you. My time has expired.
Thank you, Dr. McCoy. Really appreciate that. You know, we have about a minute left, and, you know, in the interest of time, I'll skip all the questions in the private chat about you running for public office and just ask you, how have parents and teachers reacted to your reopening plan? And knowing your work, you know, my question really is, you know, how are the students reacting to the plan?
The students love it. They need it. And they say, thank you. You've taught us all that we need to know how to live during COVID, because they don't know what they don't know, and they don't trust TV. They do chats and Snapchats and TikTok and so forth. And so they love the interaction. They love the fact that we're courageous enough to not be afraid of them. They come and they say, thank you. The parents say, we get it. You're giving power to the people, as opposed to just as the leader saying, don't come here or come here during these hours. You give us the power to say not come. So our parents, our students have loved it. Now our staff, they've missed our students, and they want to be with them, and they understand, and they are educating themselves as contact tracers, and they are in it to win it for our community. So we're committed. We're going to keep going until we can't any longer. We promise to keep people as safe as possible. And then when we can't, when we are not confident and competent, then we will stop. We will conclude it. But right now, we're confident and we're competent, so we're going to do it for our community. We're not all comfortable, but life isn't comfortable. We have to be confident and competent enough to face fear. And I'll end with that. What is fear? It's when you face everything and still rise.
Well, you can't end it better than that, Dr. McCoy. Absolutely appreciate your time, your leadership in the region, you know, at the state level even. And, you know, we just really appreciate you being here today.
Thank you so much for having me.
Thank you, sir. Take care.
Thank you.
Now joining us is the president and CEO of Behavioral Health Response, Patricia Coleman. In her role since 2012, Patricia is committed to providing barrier-free behavioral health services. Behavioral Health Response provides confidential telephone counseling to people in mental health crises, as well as mobile outreach services, community referral services, and critical incident stress management. Patricia is an alumna of the St. Louis Business Diversity Initiative Fellows, as am I, and serves as a member of the St. Louis Regional Chamber Board of Directors, as I am not. But please welcome Patricia Coleman. Ms. Coleman, the floor is yours. You might be on mute.
Okay, you all missed all of that great introduction. Thank you to all of the presenters today. It's an honor to serve on the panel with each of you. Thank you to the St. Louis Regional Chamber for all your efforts in supporting of the expansion of Medicaid in the state of Missouri. This surely will expand behavioral health to more uninsured and underserved communities. We must continue to stomp the halls of Congress, advocating for more funding for our schools and the behavioral health system as a whole. I want to just take the time to talk to you all on a few things regarding mental health. Being on this call, I'm talking to you all as parents, educators, family members. Our youth are our lifeline, and together we are being informed about mental health, which brings a stigma and discrimination to it. It is greatly important to talk about the resources we have for our school system. So dealing with children and teens, there's a fact. 1 in 5 children ages 13 to 18 will have or have a serious mental illness. 1,130 Missourians died by suicide in 2019. Suicide is the second leading cause of death among 10 to 17-year-olds. You can find that information on the website of the Missouri Institute of Mental Health and NAMI. So during COVID-19 pandemic, symptoms of depression and anxiety have tripled. There's an increase in emergency department visits for opioid overdose. The behavioral health challenges brought on by this pandemic are great. And I know that you all know that we are in the midst of 2 pandemics, COVID-19 and racial injustice. It's a lot for our youth and families to deal with. Not only has the virus led to personal experiences of uncertainty, illness, and loss of loved ones, it has profoundly impacted the social determinants of health, including housing, employment, access to health insurance, and nutrition. So can you imagine all of that going on around our children, our students, our educators, and our families? It's all trauma. Trauma is the core of mental health for all of us. So we need to target trauma, suicide prevention, and substance use in our schools. In addition, COVID-19 has highlighted pre-existing health disparities, and we must enhance outreach efforts to historically marginalized populations who have been disproportionately impacted by this pandemic. Mental health effects during a global pandemic are very important to monitor, especially in children. Although it's been estimated that youth and young adults have the lowest mortality rates from COVID-19, they are not immune to its consequences. Many students across the nation, they're dealing with sudden changes to their social lives and daily routines. The inability to access education, food insecurity, and some may even experience unsafe emotional or physical home environments. So we're back to the challenges that can present feelings of sadness, despair, and anxiety, stress. You know, some parents are struggling with the balance of telework and childcare, which may make it difficult at home. So to all of you on this call, especially educators, we suggest you try on a daily basis to focus on creating a positive environment, whether it's virtual or in person, and to continue to build quality relationships with our children. They belong to all of us. We want to help them to feel secure and confident during these uncertain times. You know, research suggests that in times of crisis, it can have long-term effects on our youth's behavior, as well as their mental health and emotional well-being. However, the right support, hard times can build resiliency in young people. giving them the ability to do better by handling stress and rebounding from a setback or challenge. BHR provides trainings for our schools. These trainings and presentations to staff and students, they promote emotional wellness and improve physical health. They are grant funded and are offered free of charge to the schools in St. Louis City and County. Of course, due to COVID, our presentations, they've been adapted to promote engagement and interaction virtually. We should support coping and resilience. Encourage our school employees, our educators, our students, our parents to take breaks from watching, reading, or listening to the news stories about COVID-19, including social media, if they're feeling overwhelmed and distressed. We want to promote to our school employees and students, parents, to eat healthy, exercise, get sleep, and find time to unwind. I know this to be true because we've been put into this virtual world. I tell you, I am Zoom fatigued, Microsoft Teams fatigued, whatever that virtual fatigue is, I'm experiencing it, and so will our youth. So in addition, BHR, we partner with Youth in Need and National Safe Place. National Safe Place is a national crisis prevention program with 200 locations in St. Louis. You may have seen those yellow signs at Walgreens, Quick Trip, or the YMCA. If someone goes there for help, the call will come to BHR, and then we will reach out to Youth in Need 24/7, and their street outreach team will provide transportation to the youth and provide placement with legal guardian's permission. So parents, educators, community leaders, everyone on this call, our youth and school system, they need us more than ever now. Let's partner together and continue to support them at the highest level possible. BHR Crisis Hotline is free. We have this service provided to you for free. Free. I hope you heard that. It's confidential. We're 24/7 for someone facing a mental health crisis. We provide texting for our youth, chat for our youth. So when that happens, you will reach a qualified mental health clinician who will triage and determine the best fit for the caller. So again, the service is free. We have a plethora of resources. So contact us at 314-469-6644 or bhrstl.org. Thanks and many blessings to each of you.
Thank you, Pat. That was really helpful. We just got a couple questions for you. Getting kids back into school is a subject that has a lot of behavioral health wrapped into it. And, what are some of the issues that you see with students in their prolonged absence from school?
Well, again, as I said earlier, they're dealing with anxiety, depression. All of these things are happening. And so we need to keep an eagle eye on them if we can, no matter who we are, parents, educators, whoever. And to know that we have these resources like a BHR, we're the front door. We may be all some have, and they call us 24/7 when they're experiencing these things. But it's a lot of anxiety and depression right now.
Sure. And you touched on this too. How have parents been reacting to the schools being closed? And, maybe what can parents do to help their children cope with the lack of school and socializing, especially that socializing piece?
Yes. One of the things they need to do is just be more because everyone doesn't have access to this, but try to do more as a family. Try to get them off of a lot of the social media, try to spend quality time. These are some of the times where we're getting the opportunity, instead of everyone having dinner at different times, now they have opportunity to have dinner at the same time. They have opportunities to sit. The parents should make sure that they're holding conversations with their children. So they are going through a lot. But I want to make sure that although we're talking about our youth, we have to keep our eye on our parents as well, because they are really experiencing a lot of things around having to go back to work. How are our kids going to be taken care of? How am I supposed to be a teacher? I have so many parents reaching out saying, I am not a teacher. How am I supposed to help my child? And so again, you have this great resource 24/7, and we will direct you in the right direction if you happen to reach out.
Well, that's really helpful. And, the socializing piece, especially for the parents, who are going stir crazy. And, I'm one of those parents with, a new baby that, I mean, newish, right? He's starting to walk and talk though. And you're wondering whether, the lack of socializing and, getting him out there and doing those very human things, are leading to anything. So, my last question for you is really, COVID isn't going anywhere. We've all kind of, come to that understanding. At least in the near future. How do you think that we deal with this long term? What are some of your thoughts on structurally, like, how we can, make sure that families are supported?
Oh, yeah. We're going to have to make sure, as I said, our youth, they belong to all of us. Our families belong to all of us. And so we need to make sure that we are giving as many resources and pouring into the behavioral health system and of course into our schools as much as possible. So we can't let off the Congress off the hook for this. A lot of the things and in the directions in which the schools and families having to cope and handle things, it all goes to funding. And so we need to continue to stump those halls and try to get as much funding as we can and help them to know that this is a priority because it's not going anywhere. But again, we can't do this in a way where it's fragmented. We all have to come together as a community to have an entire whole system. And again, earlier I heard about wraparound services. We're going to have to get active in all of those things. And so whether we have kids, whether we have children, whether we have husband, wives, whether we're working, we're all going to have to come together as one to make sure that we be innovative and as creative as possible to help our community during this time and beyond.
Absolutely. No, really appreciate that. And, we'll put up the number, your number in the chat so that folks can see. And, certainly, as we move through, the next weeks and months, the chamber will be there to support you and, trying to get funding from Congress, certainly, for this. A great resource for the community. Did you hear, everybody? It is free. So please spread the word. And Pat, really appreciate you being on here with our members today and taking the time.
Thank you.
Thank you very much. And now joining us is the Chancellor of Southern Illinois University, Dr. Randy Pembroke. Dr. Pembroke became the 9th Chancellor in Southern Illinois University Edwardsville history in 2016. Before his role with SIUE, Pembroke served as the Vice President for Academic Affairs at Washburn University in Topeka, Kansas from 2011 to 2016. Dr. Pembroke is also a member of the St. Louis Regional Chamber Board of Directors. Please welcome Dr. Randy Pembroke. Dr. Pembroke, the floor is yours, sir. Oh, and we might have you on mute as well.
All right. Thank you, Austin. I appreciate the invitation to be with you today. I also want to say thank you to Tom Chulik at the St. Louis Regional Chamber. It's a privilege to be part of that organization. I want to say thank you to my fellow panelists. I appreciate all that they're doing in terms of education and health. I was asked to come today to briefly talk about higher education and what it looks like this fall in the age of COVID, specifically at SIUE, and then talk a little bit about the business impact of things that are going on. I want to start by just sharing some good news, and that is that this summer, after we had the experience in March where everyone went home and studied online, this summer we didn't know exactly what enrollments would look like. And at SIUE, we were up 7% in terms of FTE. And so I think there was a hunger for students to continue studying, and that was a good thing. As we look toward fall, our enrollments are holding steady, knock on wood, and we expect to have about 13,000 students on our campus. The difference, I think, in what we'll be looking at in 2021 versus previous years is that we're making some of the same accommodations that you heard other panelists talk about. We think that of the courses that we offer, approximately a third of those, around 30%, will be traditional on-ground experiences. We are trying to focus those for new students, and particularly for students who need hands-on experiences. So things such as our science labs and our arts experiences will take place in that way. We had a great summer in terms of our faculty looking at ways to teach and exploring new pedagogies. So in addition to the on-ground courses, we'll be doing about 30 to 40% online. Those are offered in both synchronous, meaning that all the students are online at the same time, versus asynchronous experiences where students can complete that at any point that is convenient to them. Then an additional way of presenting material, which is exciting to me, is what is known as hybrid courses. And so in those settings, students will be on ground for part of the time, but then they will be online for the remainder. So imagine taking a class on ground, seeing other students in the classroom on Mondays, and then on Wednesdays and Fridays doing online experiences. We've had some great work coming from our academic continuity task force. Eric Ruck and Josie DeGroot worked on that and led our faculty efforts this summer, so I want to thank them for doing that. We are, SIUE is the largest bachelor's producer in the St. Louis area, and so I think it's important for our students to succeed. We're looking for them to have wonderful experiences this fall. We'll be doing some of the same things that they're used to doing. We have over 300 student organizations. We have Greek Life. Those things will be continuing. We're not sure quite yet about athletics. We have had several meetings in the last 2 or 3 weeks about our Ohio Valley Conference and the NCAA, and we'll see for sure where that's headed. The two options seem to be to continue to do athletics in the fall, or to move things to the spring, and we'll see which one of those ends up being the outcome. One of the things that will feel different, I think, for our students this fall is that in Illinois, as part of the Restore Illinois plan, rather than having large gatherings, so when you think of things like homecoming or commencement, we'll be doing things in groups of 50 or smaller. And so I think students will enjoy that. In some ways, it'll give them more of an individual interaction with a smaller group of students, so they'll get to know each other better. We have personally adopted some processes. Our students will be sitting at least 6 feet apart in classrooms. Our students and our faculty and staff will be wearing masks, and we will have a lot of plexiglass on campus in high traffic areas to try to stop the transmission of the COVID virus back and forth. We're also exploring, as a lot of other Illinois institutions are, the testing procedures. We are working with the University of Illinois to look at processes in terms of both ongoing widespread population testing as well as surveillance testing. So we'll be announcing more about that later. I want to say that I've been very impressed by our faculty, by our staff, by our alumni association in doing virtual events. And so we've had virtual cooking alumni events. We have virtual runs and virtual fundraisers on campus. And different parts of the university, such as engineering, nursing, they have stepped forward to try to address the COVID situation. The engineering people came forward with 3D printers and made face shields for local hospitals, for local police departments. So that's been very impressive. I also want to say that in the last couple of months, we have looked at the situation going on with racism in our country and the concept of equity, diversity, and inclusion. And so we have a task force that's working hard on those issues. And so when it comes to diversity training, if local businesses have an interest in that, local organizations, and want to contact SIUE, we have some amazing experts that can help individuals and companies. The last thing I'll say is that from a curriculum standpoint, one of the things that I think is most interesting at SIUE is we are working on something called badges. And so if particular companies have areas of expertise, if they have a particular focus, whether it's in accounting, whether it's in chemistry, wherever that might be, we are trying to put together these very specific post-bachelor's programs so that individuals who work at businesses can get a specific kind of training so that they can do, for example, chemical analysis with particular equipment. So I hope that as businesses think about that they will reach out to us. We have some wonderful people in continuing education, and I know that they would love to help people develop badges for their companies. So with that, I think I'll stop, and I will stop by saying, conclude by saying thank you. We got some tremendous support from both the federal and state government regarding the CARES program, regarding gear funding. It has helped support students and their needs, and it basically has helped us keep going in this very challenging time. So let me just conclude by thanking the legislators who I know are working very hard to make sure that higher education continues in this COVID age. Thank you, Austin.
Dr. Pembroke, thank you. Really appreciate that update. Just real quick question. Have you spoken with Governor Pritzker of the state, or other universities to coordinate reopening efforts?
So what in the state of Illinois, the governor's office has created guidelines working with IBHE. And so some of the things that I mentioned about the social distancing, the ways to provide education, meeting in groups of 50 or smaller, the masks, those are things that are coming with the help of the governor's office and the Illinois Board of Higher Education in Illinois.
Thank you. And here's my question, how do I say this? So unlike our previous guests, Dr. Adams or McCoy, your students, some of them are over 21, like to hang out together at night and the weekends to socialize. And what kinds of challenges does that present on a college campus?
So in some ways there is evidence that coming back to campus may be safer than continuing in higher education from mom and dad's basement, for example. And one of the reasons for that is because we have these educational points where we can talk to students. So we just premiered a video that we created locally, talking to students about being smart, keeping your distance, wearing your masks, and particularly like for our athletic teams, it's important not to put themselves in dangerous situations. So I hear what you're saying. We're hoping that our students pay attention to the things we're saying in this area, because if people are socially responsible, they can make a huge difference in terms of bending the curve on COVID. And if they're not, it can lead to some problems, some situations that we don't want. And one of the things that we're underscoring is if you like being back on campus, if you like on-ground courses, if you like hanging out with friends, do it in a responsible way so that we don't end up in the situation that we saw in March and April.
Sure. And so is campus housing, I would imagine, is reflective of, social distancing guidelines, and, how are you adapting there?
So what we're trying to do is give students choices in terms of whether they would like to be in individual rooms, whether they like to have roommates. We have our residence hall set up does not require a lot of people to share spaces like bathrooms, typically 1 or 2 people, sometimes 3. And so teaching responsible behavior there in terms of cleaning. As I mentioned, we are not going to have external guests in terms of visiting the residence halls. And so we're trying to help students be smart in terms of their behaviors within the residence halls. The interesting thing to me is that we're down just a little bit, as I mentioned, but not too much. And so I think there still is a great interest in living on campus as part of a college experience.
Sure. And is there any sense of, how, the teachers and professionals that work at the university and the students are feeling about returning?
Well, one of the things that I appreciated, I mentioned Eric and Josie before, and our provost Denise Cobb. We had some really good conversations in May and June about comfort levels and what people's lives were like and who had people that they had to take care of at home. And so that breakdown of classes, as I said, 30% on ground, about 40% online, and then a certain percentage hybrid, that reflects the students and the faculty had a chance to migrate toward the formats that made the most sense for them. So if they were wanting to be conservative and think about health issues, they could do online. If they wanted more of a social experience, they could be on ground. So this isn't 100% accurate, but most people, I think, are experiencing courses and teaching courses in the way that they had hoped.
Sure. And my last question, just your thoughts on the future, of SIUE, Edwardsville, in just the college experience, do the online, platforms remain robust, and, do tuition rates change because of this? And, what kinds of structural, changes do you think will probably stick around?
I think that the idea of taking courses online and teaching courses online, since we went to that 100% in the spring, I think that will continue to be a popular model. I do think that 18 to 22-year-olds like to be in college settings. And so even those that are learning online have the ability to be on campus, to be part of student organizations, to go to the library, to hang out at Starbucks. So I think that will continue to be a part of the future. It's just that mix of on-ground, online. I think we'll continue to see that migrate a bit.
Sure. Dr. Pembroke, really appreciate that, and really appreciate everything that you're doing over there to serve as a model in Southern Illinois for getting back to school safely, and appreciate your time this morning with our members.
My pleasure. Thanks for inviting me.
All right, take care. And I want to thank everybody for joining today's COVID-19 briefing. And as our region, our nation continues to reopen, the St. Louis Regional Chamber remains committed to serving as a resource, convener, and advocate for our members, investors, and community partners. Please join us for another COVID-19 briefing for a federal legislation update with Illinois Senior United States Senator Dick Durbin. That Zoom meeting will be held Tuesday, August 11th at 10 a.m. Please see our website for more details, and thanks again for joining our virtual meeting today. This meeting is adjourned.